The COVID vaccine is front and center in the news right now between booster shots and vaccines for kids. It's a lot of information to take in. This morning, Megan Bragg verifying your questions about the vaccine for children and adults.
We've gotten several questions through our social media pages and our Verify email, both about the booster qualifications and the COVID vaccine for children. Let's start with the booster shot. Viewer Sandy Stewart writes, with the FDA's booster ruling, I have a question for those of us who are not elderly but are with lowered immune systems. I believe we're eligible for boosters. So who needs a booster? Our sources, physician Dr. Carla Robinson and the FDA advisory panel. Friday, the advisory panel voted to only distribute COVID booster shots to people ages 65 and up, as well as those at high risk of severe illness. Dr. Robinson says these boosters should only be given to two groups.
We recommend speaking with your healthcare provider regarding the appropriateness of a booster vaccine for you. You know, there may be some medical condition that you have that predisposes you to being a good candidate for the booster vaccine.
Now let's take a look at some questions from parents about the Pfizer vaccine for kids 5 to 11. On Monday, Pfizer said the vaccine works for children in that age group and will seek FDA approval soon. But many parents are wondering, is the dosage different for kids than it is for adults? Our sources, Dr. Carla Robinson and Pfizer. According to Pfizer, ages 5 to 11 will receive a 10 microgram dose level, which is about a third of a dose that adults are receiving.
The same medication, just a reduced dose, reduced volume. And that's something that for now the data has shown to be effective.
Finally, will kids experience the same symptoms as adults when they receive the COVID-19 vaccine? According to Pfizer, the study that involved children ages 5 to 11 was well tolerated with side effects generally comparable to those observed in participants 16 to 25 years of age.
You certainly have the possibility of local side effects like injection soreness or redness. And then certainly there's also the possibility of systemic reaction. And that's something that we saw quite prevalently with the adult population.
If you have any questions that you want verified, feel free to send us an email at verify@wcnc.com, or you can reach out to me on my social media. With your Verify, I'm Megan Bragg.